Okay, so uh, for which patient, okay, you'll be encouraging this activity?
Paraplegic.
Yeah, paraplegic, yes. So it may not be suitable for the people who are having tetraplegia, obviously. Okay, so paraplegic patients, so shifting themselves from the wheelchair to the mat.
Come closer.
Okay.
Change place with me. Change place.
Okay, the procedure is as usual in exam point of view. So introduce yourself and then explain the procedure. So what you're going to explain to the patient. So the procedure today you're going to teach is wheelchair to the mat. Okay, how you will be introducing or how you will be explaining the procedure to the patient.
Introduce myself.
Sorry.
Introduce first. Then introduce the examiner.
Okay.
Then read the patient. Run through the patient.
Okay.
Uh,
That what kind of explanation about the procedure? For example, some patient is there, like today you're here for training the wheelchair to the mat transfer. Okay, so then what are the further instructions you'll be giving? Okay, so for this training purpose, actually we need a mat, a wheelchair, so with a proper working brake system. Okay, so in order to prepare the patient to transfer from the wheelchair to the mat, so first we'll be asking the patient to lock the brake. Okay, so the patient will be in sitting position. Okay, so make sure that lock the brake. Okay, so will that be possible for the patient to just do this movement? Is that possible? Is it possible?
Using the upper arm.
Using the upper arm.
Yeah.
Keep hiking.
The weight
Yes.
shift.
Yes. The patient can do the hip hiking and do move. Okay, they can press using the hand or with the elbow. Okay, it's up to the patient's comfort. Okay, you can modify it accordingly. Okay, so first we have to ask the patient to press, and so when you're practicing, you yourself don't feel your lower limb. Okay, so just
Up.
so if you look at my feet, I'm not putting any weight on that. Okay, that's it. Okay, move forward. Okay, then what is the next procedure if you wanted to get down? So how can you bring the center of gravity, means line of gravity, outside the base of support?
Forward lean.
That's it. Okay, so you have to bend forward. Okay, so bending forward will create a moment, right? So it creates a moment anteriorly. Okay, so when the patient moving forward, right? So then have to bring one hand forward, down. If it is a obese patient,
A what?
if it is a obese patient,
Oh,
Please.
fish for roll.
yeah. So how?
The therapist needs to stabilize.
The patient should be therapist assisted.
Yes. So self one bit challenging. But anyway, we are supposed to train them as well, right? Okay, let's forget about that. Keep it aside. Just go for the a normal 25-year-old paraplegic something. Okay, so he need to bend forward. So he is trying to bring the line of gravity falling outside the base of support. It creates a moment. Okay, so then he needs stability. Okay, how he will be achieving the stability is by putting the hands down. Okay, one hand down followed by the other hand. Okay, one hand down followed by the other hand. Okay, then how he will move further? Crawl.
Forward.
That's it.
So this procedure should be supervised by a therapist, right? Or the
Initially,
patient.
when you are training, yes, but later on they will do by themselves. So, crawl, okay. That's it, like that. Okay. If they wanted to sit, put, roll, sit. Okay.
Mm. Next one is
That's
when you
it.
back forward.
Got it, right?
你的
That's it.
gravity out.
This is the individual forward transfer
Mm-hmm.
from the wheelchair. Okay, so when you are practicing, you just forget that no sensation in the ground, right? Okay, fine. Okay. So if it is if it is from floor to the mat to wheelchair, how you will be doing?
Go back to quadrupeds, then crawl back.
Okay. Is it possible?
The
Can
wheelchair should
try.
be at the back of the patient.
Yeah.
The wheelchair should be at the back of the patient.
Okay.
Lock the brakes.
Okay.
Crawl backward.
Is that possible? Any other alternative?
Ask for therapist help. 2-man lifting, lift him up.
If it is self. Okay.
The side.
Let's keep it aside. First, do with this, because sometimes like the OSPI questions, it may be asking you only to go for the forward transfer, along with sometimes, if possible, like wheelchair to floor, floor to wheelchair, something like that. Okay. So now I want you to practice first. Okay. Then we will proceed to the next. Foot is not touching, but actually, this is going to help her. Right, so put the foot on the ground, because again we are not going to have the muscle force, we have to remember that. Alright, so just push, okay. The other hand will be holding the armrest, bending forward. Now itself I got the moment. Okay. Automatically it goes down. Yeah.
So you are still using your leg to control.
Me? No. You feel like that?
It's the nature of like
So can I
our
try
nature.
for a
Yeah,
It
please.
will like
It's a
automatically
reflex.
From prone, how will you bring the patient to?
你的慢慢，好好好，拜拜，好，好好好，对对对，
So from prone, like from wheelchair they'll go prone. From prone, have to turn, means like rolling. What rolling is that? Is that segmental or
Lock,
log?
lock rolling.
Log rolling, right? So with that, go for sitting position. Yes. Long sitting. Yes.
慢慢喊呀，
Yes.
再来，
Yes. Push, push, push. Yes. Then put the hand. Yes.
Oh.
对对对。
So from that,
The
long
last
sitting.
few steps accelerate.
Right? So from long sitting, so the next one is like train the patient for kneeling. Kneeling. The mat activities you guys remember, like therapeutic skills, like whether everyone attended that one. Yeah? No problem, like I'll ask one to demonstrate, then we will proceed with that. Okay. From long sitting, okay, so how you will be going for kneeling? If you wanted to go for kneeling, what will be the position you will select?
I'll go for quadrat first.
Quadruped, okay. From there you will go for kneeling, right? So okay, from long sitting, how you go back to quadruped? Is that possible?
Side sitting.
晒晒。
Side sitting.
Okay.
好像是对了，刚才这样过来是对。
还是
对，你可以这样放，然后你这样过来。另外，如果你这样，你就过去那边。这样就过来这边。
Is this possible?
Can try.
Because lower limb is paraplegic.
But
Won't
once we activate the upper limb in segmental rolling, so the lower limb will follow as well, right? Then we doing that to add more leverage advantage.
Okay.
So I think we can give it a shot.
Okay. So, but you can't bend and keep it like that because it won't stay. One thing you can do is like you can cross the leg.
Yes,
Lift,
you put you put the feet underneath the contralateral cubital fossa, popliteal fossa.
Yeah.
没有，另外一边。
That's the.
好像是很
best
对对，
way.
自己这样自己
But they
这样。
wanted to try.
Whoa!
Can.
Can.
So what we can do, the same thing, just cross the leg. Cross the leg. Okay. Now turn, put the hand, yeah. Now slowly walk and try to roll. The elbow down, yeah. The elbow down, yes. This way you can do, like log rolls. And then from there push the elbow and walk back, bend the like this you can come.
Okay.
This is the way. So come and show again from long sitting. Okay, so long sitting, take the leg, cross, okay, put the hand back, yes, rotate, put the hand back, okay, long roll, roots. And after that, how the leg is released, yeah, you can just come. How we are going to take the leg? So how are we going to clear that?
With hip hiking also no use, right?
Yeah?
With hip hiking also cannot.
What's the question again, sir?
No, if she is crossing the leg. Yeah, now she did this one. Okay, now putting the hand down. Turn, yes, yes. Now it is open. It opens. Yes. Then it opens.
Oh,
That's it.
ごめんなさい。
Yeah. And from there, kneeling. How you will be doing the kneeling? How you will
Side
be
sitting.
self without any. No, you're almost in this position. Okay, this position. How you will go for kneeling? You have to crawl but yourself.
哦，然后这个
Lift. This
大
way.
概一个脚的前面是好。
So then you use hip extensor, right?
Yeah. Hip extensor. Yeah. That one depends like whether the patient is suitable to do that or not. So based on the preserved muscles, then you will be training this. Whether the patient is having good hip flexors, extensors working, then you will be going to that training. To the kneeling.
啊。Nail sitting. Sit on your calf is nail sitting, right?
So these
Ah,
are the
this one,
techniques
so
for
on the-
kneeling. The patient achieves quadruped position before kneeling. Moves the hand backward towards the kneeling, prone kneeling position. So pelvis is dropped. So patient sits on the heel. So patient supports his upper limb on the therapist's shoulder even, right? So if therapist is there, then put the hand on the therapist's shoulder, push and then get up. Okay. If yeah, so to the kneeling position. If not, by thrusting his upper limb and extending his neck and hip, patient raises himself to kneeling position. Okay. So there the therapist can support the pelvis, guide the pelvis and pull the pelvis.
To shin bone.
Okay.
It's
So
real
that one can
hypertrophy.
be done. If the patient themselves wanted to do, they can just slowly put the hand on the knee and try. Okay. So sitting like that.
Gower sans.
Yeah, exactly. We are using that to get up.
But this will use
Hip flexors. Yes. Because for that the muscle should be
Why the hip
preserved.
flexor?
Then you can't do
Why
that.
not hip extensor?
Fine. So can someone show the mat activity, please? Mat. So after the mat activity, then I'll pass it to Mr. Kavin. So he'll be taking over. So, in the paraplegic patient, okay, can you please still the. Okay. Still. Okay. So fine. Can someone come and give the instructions, please? No. From supine itself, go for prone position. Yeah. So the mat activities, what will be the first instruction?
你可以抓他的脚起来，另外一个就是他手放你肩膀，他自己拉自己起来，或者如果他比较稳，
Is it that
你
possible?
可以抓着他两边的iliac crest。
Ask the patient to clasp the hand, create the moment. Yes. Swing and turn. Yes.
100分 model，
Yeah.
不能再看。
Because paraplegic, right? So crossing. Because paraplegic patient is going to be difficult. Because either for that they have to sit and cross the leg and turn. So instead of that, they can do segmental rolling. So through segmental rolling, it automatically does. So for crossing that one, we go for log rolling. Okay. Then prone on hand prone on elbow. So prone on elbow. So you will be bringing this position and you will promote the activities, right? So what are the activities possible? For example, balancing, okay, shifting, okay, to both sides, and then reaching activities, okay. So initially place the reaching activity within the a closer proximity, and then challenging should be increased by placing it bit away. So for example, so if I'm placing something here, okay, can you please take this one?
Oh, sorry.
Yeah, with the right hand. See, now she has to shift the body weight much. If I'm placing it closer, very less. Right, so it is making tougher. That's it. Okay, so something like this. Okay. Okay, so can you feel the toughness? Yes. Something like that. So you can promote it accordingly. Okay, fine. So yeah, from prone on elbow, you can go for prone on hand. Okay, prone on hands. So yes, shift the body weight to one side. Okay, shift the body weight to the left. Okay, put the hand. Okay, then yes, you have to push the opposite hand and then you have to bring. Okay, so prone on hands. From prone on hands, you can take for, yeah. So ask her to crawl backward. While doing so, flex the hip. Okay, is it possible for this? Yes. Again, it depends on the availability of the muscle power, right? So if it is, if the injury is at which level the patient can able to do the hip flexion?
L1, L2.
Before that, is it not possible?
Below L2, sir.
Yeah,
Below L2.
below L2. What is the root value for hip
L2 is
flexor?
for hip flexor.
Sorry,
L2 is for hip flexor.
hip flexor, right? You have to look for the myotones. Okay, so which spinal level? So spinal level is different, nerve root level is different, right? So which level?
T12 and below.
Right? So injury below T12, right? So you should not get confused. That is the vertebral level and this is the spinal level, right? Because you are going to approach the patient based on the vertebral level. right? So in that vertebral level, you will be correlating that with the myotome, which is the nerve root level, right? Fine. So the patient can able to do from prone on hands to quadruped position. Okay, from quadruped we'll be doing the, yes, from quadruped, yeah, what are the activities possible? Raising the hand, okay, shifting the body forward, backward, okay, sidewards, okay. And here you can do gait training. You can start the pattern of gait training from here itself, right? You can make the patient to crawl forward, backward and sidewards, okay. Now here you can hike the hip and bring forward. Yes, it's going to be bit bit hard. So, but if you are training it gradually, it's possible. Okay, and then side.
But if bring backward, how to hike?
How to hike? Okay, so bringing backward, just shift, put it back. It's possible actually. T12 injury, it is possible. Okay. Again, you have to include the things based on the availability of the myotome, because if it is a partial injury, there are chances for few muscles to be preserved, right? Anyway, before starting these things, you are going to prepare the prepare it segment by segment, right? After that only you are going to progress with this. Make sure that they can able to do hip flexion, hip extension, the stuffs, then do this activity. Okay, sidewards. Okay, so move this hand. Okay, yeah, take your right leg high and put it wider, then bring the other leg. Okay, so there you have to stabilize, means support the patient. Okay, okay, take the hand here. Okay, and your leg that side. Okay, this hand here, that leg this side. Okay, so all these can be done in the mat or in the bed if it is wider. Okay, otherwise bring the patient down to the mat and do it. Okay, so from here patient goes for kneeling. Okay, can you please come front? So is it possible for you to be the therapist for her to put the hands on your shoulder? So you have to be in the kneeling position. Okay, yeah, put one hand on her shoulder. Okay, that's it. You're closer, bit closer. Okay, yeah. Now what you have to do is you have to bend forward. Okay, bend forward and grab the pelvis. Yeah, and you have to pull towards you. Okay, and keep the face sideways, please. Okay, that's it. Okay, go down.
I do.
This training you can do it. Okay, and from here. Come again. So after training this, making the patient comfortable with this, you can go for half sitting. Half sitting, what you can do, hold over the under the thigh, yes, and bring it. You're in this position. You have to keep it like this.
Half
Yes.
kneeling.
Half kneeling. Yeah, no, not half sitting, half kneeling. Yes. Okay, take it back.
Sorry, bạn thì kể ra.
Okay, take it back. Train that, yeah. Okay, so like that. Okay. After that, you will be training the patient from sitting to standing. Okay. Maybe you can put some chairs. Okay. So ask the patient to be bringing the leg. Okay, then you can support it. Otherwise, you can support. For example, one at the back. Okay, you can be in the standing position. Hold the hands. Okay, so these are all, like once after developing the muscle power. Okay, this will not be possible in the very beginning. Okay, so yeah, put the left leg forward. Put the left leg, and then slowly get up.
Nhìn nó 太像了。
Yeah. So we can use the you know, this sitting to standing training, this is going to be very, very challenging. So rather what we can do, make the patient to sit on the couch or chair, put the walker, right? So from there, you can ask the patient to get up. Okay? Fine? So you can do that.
Waltz.
Okay? That's it. Okay then. Fine. So do you guys want a break? Now time is 12.
It's-
Yes?
it's
Yeah.
lunch.